Hi, Terry Kuti with Deep Sea Foundation, and I'm continuing my conversation today up at Mayo Clinic in Scottsdale with Dr. Raman Mahabir. He is a board-certified plastic surgeon. Welcome.
Thank you.
And continuing our conversation, we were talking about, I'm a patient advocate. You were talking to me a conversation about how doctors advocate for patients. Can you tell us a little bit about that?
Yeah, as I was watching you making some of these videos today, Terry, it really hit me. The work you're doing is so important, being an advocate for your patients. And I think physicians, we can take the opportunity to that ourselves. Each year, myself and several members of the American Society spend a couple of days actually, either at our state capitals or even at the federal capitol. There's a group of us that go to Washington every year. And we're not there petitioning for changes to rules and things that are going to make our lives better. We're there for our patients, because it's an opportunity to give back in a different way. And the Breast Cancer Patient Education Act that was passed, that's a great example of being able to really make a difference for our patients. And so as a surgeon, being an advocate for my patient, not just in the clinic, not just in the OR, but at those levels, that's important to me as well.
Oh, that's good to know. Did you see me smile when you mentioned the Breast Cancer Patient Education Act? If you are on Twitter, look for that hashtag. If you ever see me tweeting out BCPEA, Breast Cancer Patient Education Act, there was a lot of, I know there was a lot of work done by some of your constituents on the Hill for that. And so we're glad, because the focus of that law that was passed was to educate more women about their options in breast reconstruction. It's a monumental job, we know that. So good to know that you guys are advocating for patients.
Terry, it's a great deal that was passed. It's sad that it had to be passed.
Yeah.
It's sad that we have to do it by passing a law that mandates that surgeons educate their patients. But at least with it, patients need to know what that is now, because for every patient, they need to know what their options are, because the only way to make the decision that's going to be right for you, right for them, is to have all the information they can to make that decision. And it's a tough decision every time.
Well, it's a big job that we all work on together.
Thanks for partnering in it.
Absolutely. Glad to do it. Thank you.